The APA is at the forefront of bringing the spiritual and mental health communities together. Recently, 40 such leaders gathered to inaugurate the Mental Health and Faith Community Partnership.
Who've come together for a very common purpose here today, and that is to find ways to reduce the stigma of mental health conditions and improve community-based services for individuals and their families.
I was really pleased with it also, and I think both sides learned something, and I hope that psychiatrists learned how faith communities can be a resource to people with mental illness.
We come from a culture and a nation in which the separation of church and state is a core value in how we think about ourselves. But today we're looking at how we bridge that gap between mental illness and faith communities.
We need to look at the both and versus the either or, and a person of faith can certainly continue in their religious observance and at the same time receive mental health care. Some people have felt that that was mutually exclusive, but it is true that people can do both.
You know, we say in our illness that we have a threefold illness, a physical allergy, a mental obsession, and a spiritual malady. And that if we want to get well, we have to address all three of those concurrently. We don't do that in healthcare. We tackle one and not the other.
So that boundary between what's illness and what is despair and what is existential or developmental challenges is not always straightforward.
1 out of every 4 Americans has a diagnosable mental illness. The lifetime risk for any individual to develop a mental illness is 50%. About 84% of Americans are affiliated with a faith.
I think we got a really nice sample of different perspectives on this faith and mental health interface.
We share something in common, which is we hear people's life stories.
There are a lot of people out there looking for meaning, and they are looking to both of you for answers. And so today, let's help them find some.
When you begin to look at your health, you also need to take care of your mental health, but also your faith health. And I think bringing the two communities can add value to get the person, be it the congregant or the patient, in a way really look at their total well-being, from mind to body, and including their faith commitments.
Spiritual faith and psychiatry aren't mutually exclusive. Visit psychiatry.org/faith to learn more.
Last time I was with APA was